I'm Dr. Benjamin Shu, a glaucoma specialist here at the USC Roski Eye Institute. This is my team, and we're conducting a study to identify patients who are at high risk for a disease called angle closure glaucoma. We developed a new way to detect patients who are at risk, and if you'll follow me into the booth here, you'll see that we have various devices for taking pictures of people's eyes. We have a cutting-edge device called an OCT system, which you see in the back, that takes high-resolution pictures. And in the front here, we have a low-cost camera that can take pictures also very quickly, but doesn't provide as much information. So here we have a high-cost and low-cost device. And our goal here is to establish these devices as the alternative to an in-office procedure called gonioscopy, where a contact lens has to be placed on the eye. This can be very uncomfortable for some patients and requires a trained eye care provider to perform. These machines can be operated by technicians and also utilize AI to make the process more convenient. So I'm going to have two of my research assistants here demonstrate how the OCT machine works and the camera works. So what we'll see here is that a patient who is seated in front of the OCT machine just needs to put his or her chin and this machine, in just a few seconds, will acquire beautiful high-resolution images of the inside of the eye, which will tell us if patients are at risk for angle closure glaucoma. And our recent work by our lab has shown that OCT imaging is much more predictive of patients' clinical outcomes compared to what we're currently doing in the clinic using gonioscopy. So you can see now. So
you can look inside the lens, please. All right. Keep your eye open as much as you can. When slightly open your eyelid. Here it goes. Hold open, 3, 2, 1. You can relax.
Great. That's good. So you can see just in a few seconds, we've acquired images that we'll show in just a moment. And using AI, we can analyze these images at the level of a trained glaucoma specialist. This is important since most clinicians don't have time to be manually analyzing their images in the office. And so here's a picture of the eye. So what we can see here is the cornea, the lens, as well as the iris. These are the structures in the front of the eye. And what the AI algorithm does is it produces these measurements that tell us about the amount of space in the eye and how high risk the patient might be for angle closure glaucoma. And so in the future, rather than having clinicians perform gonioscopy, again, which is expertise dependent and uncomfortable, they simply need to take a quick picture of the eye, and this gives a much more precise estimate of that patient's glaucoma risk. And so this is just a demonstration of how we might be able to use AI and non-invasive ocular imaging to identify patients who are at risk for glaucoma as well as glaucoma-related vision loss.